Hello, this is Dr. Carmen Fong and welcome back to Gut Feeling. I can tell how healthy you are just by your poop. That's right, just by looking at your poop, I can tell how healthy you are. So most people will tell me that they know about the Bristol stool scale, which is actually called the Bristol stool form scale, which judges how hard your poop is, right? So on a scale of 1 to 7, generally 3 to 4 are considered to be healthy poops, which means formed, but not too liquidy and not too hard. So it shouldn't be liquid and it shouldn't be rabbit pellet-like. Now, if it is the way to fix it, it's actually pretty simple. Generally, hard poop and liquid poop, it's a sign of your hydration status. So having more firm poops means that you need to drink more fluid throughout the day, and having more liquid poops means that you need to drink less fluid throughout the day, or you might have some gut absorption problems, which we'll actually get into later. Some other red flags though, right? So that most people should be pooping 1 to 3 times a day, every 1 to 3 days, and that's a normal range. If you're pooping less than that, so every 5 days or so, you tend to be on the constipated side. And if you're pooping more than 3 times a day and it's all liquidy poop, you tend to be more on the diarrhea side. Other red flags to look out for, obviously stool color changes. So stool can be a pretty wide range of color. I always like to say they can be pretty much every color of the rainbow depending on what you eat. But the most common ones are gonna be brown, yellowish brown. Sometimes you can have greenish bile into it. What is generally a problem is when you reach the ends of the spectrum. So the same way when you reach the ends of the spectrum on this Bristol stool scale, if you reach the ends of the spectrum on the color wheel, then you're kind of running into problems. So black tarry stools can mean that you have some digested blood in there, which can be sign, of having colon polyps or colon cancer. And then really, really white or pale stools might be sign of a metabolism problem or an absorption problem. So you don't want black and you don't want white, but everything else in between can generally be okay. You can even have pretty maroon stools that are because of, drinking red Kool-Aid that day or eating beets. Obviously, if you're seeing bright red blood, that is another red flag that you should be going to see a medical provider, to check out the issue. Now, fixes. I kind of talked about the fluids already. So, which is that, if you're not drinking enough water, you need to drink more water. If you're drinking too much water, you should drink less water. Fiber is always the key, right? Only evidence that fiber is good for you, but you don't want too much. So everything in moderation, including moderation. Thank you, Julia Child. What you want is 25 to 35 grams of fiber a day. Too little and your stools will be hard. Too much and your stools might actually also be hard. But what fiber does is it actually normalizes your bowel consistency, your stool consistency. So you actually want, when it's too hard, it softens it. And when it's too soft, it firms it up. Isn't that amazing? You both want soluble and insoluble types of fiber. And aside from fiber and water, obviously we know that the microbiome plays a big role in gut health, which means that probiotics have been shown to help with the consistency of stools. And some types of probiotics will help when you have more diarrhea type, and some types of probiotics will help when you have more constipation type. We're definitely going to talk about that whole gut microbiome thing in its own episode. So until next time, trust your gut feeling, and butt health is gut health.